Kubwa, a town in Abuja, the Federal Capital Territory of Nigeria, is considered to be one of the largest satellite towns in West Africa. A few kilometers beyond Kubwa lies Zhiko community. With the availability of good roads, the drive from Kubwa to Zhiko community should take 5 minutes. On the contrary, it was a bumpy 30-minute ride. Zhiko is only accessible through trucks or the popular commercial motorcycles, which are readily available in Abuja satellite towns. I arrived Zhiko on a motorcycle to meet a warm and friendly people who were willing to talk about their challenges. Zhiko is a small, picturesque village surrounded by mountains and 4 other villages. After a brief stop of introduction at the village chief's palace, I asked to see their primary health center. Nigeria operates a 3-tier health system: the tertiary level, the secondary level, and the primary level. A web search of primary healthcare in Nigeria will bring up articles on abandoned or barely functional health centers in the country. Despite having read a few of these articles, I still wasn't prepared for the deflated feeling of disappointment at the sight of the primary health center in Zhiko, which was under lock and key. The health center is headed by a community health worker, Lami Sai, who is popularly known as nurse by the villagers. She has only 2 staff, a health attendant and a volunteer from the community. It is also the only health facility available to Zhiko community and its neighboring communities of Pasepa, Iyabisa, Gweipe, Pazamo, and a Fulani tribe settlement called Gwambature.
I've worked here for about 11 years now. This building has been like this since I started work. Anytime there is rain, breeze will now take the zinc out. This year we were not able to work during rainy season because the rain was too heavy and the place was leaking.
The exterior of the facility tells the story of a building that has been on a steady decline. It is obvious that the building has never been renovated since it was built.
The person you are talking to was the one that built that clinic while I was counseling. My first tenure was in 1987-89, and I built that clinic in the year 1998. And the second tenure was from 1997 to 1998. That clinic, the way you have seen it now, is in a better form. If you people had come before now, you would have seen how shabby the clinic is.
A few nights before my visit, the roof of the building finally caved in. Luckily, nobody was around at the time because the center does not operate on 24 hours basis. It is only open between 8 a.m. to 2 p.m.
Offer antenatal services, family planning, HIV, even minor treatments like malaria and typhoid, we do that, and even immunization program. Alright, in delivering we do.
So like how many patients do you get here, like in a day and in a month? Can you estimate it from
like
here?
Antenatal patient, it depends. Sometimes we get a month, 10, 15 or so.
So this room now
It's consulting.
consulting room. Do you people have any doctor that comes around once in a while?
No.
No doctor at all?
No doctor at all.
There are no materials. There are no materials, and we have been writing, even herself, it's been writing letters to the local government. But we have not gotten any positive response yet. But we hope it's going to happen by God's grace.
It's been over 2 weeks since the roof of the building caved in. The equipment and registers have been moved to a makeshift clinic at the primary school in the community.
Handle it. You see, the community is safe.
So this is their makeshift clinic.
Lami Sai explains to me that the community volunteer had been attending to patients some hours prior to my visit. He had to leave to attend a training program.
Body pacing, but sometimes in my salary I do give him some things. Sometimes I'll get drugs in my salary, I will give him anything he has, then he will take. But because of the challenges of the community, don't do that. But every month sometimes I will give him something.
I noticed the meager supply of medication on the table made up of folic acids and vitamins. He had obviously been attending to some pregnant women. Lami confirms my guess.
She formed a committee.
The nurse.
The nurse formed a committee in the community here. They have chairman, they have secretary, they have everything. As you know, the association members are. They have the computer or something. Now, there was a time the community contributed the money and bought drugs. And they have been revolving the drugs. Sometimes people want to take it, but not always. And even present now, you've heard from the nurse that there are not enough drugs.
There is only one patent drugstore in Zhiko community, which caters to Zhiko and the neighboring communities. The patent drugstore, owned by a businessman but run by a young man who was forced to drop out of college as a result of lack of funds. He is popularly known in the village as Young Doctor. Where do you get your medicines from?
Medicines from, I didn't go to Bari, so then I go to Use.
Okay. And you're living within the community, right?
Yes, ma'am.
Are you open 24 hours?
Yes, ma'am.
Or they can call you when they need any urgent medicine?
And call me anytime.
Then you come out and sell to the community.
The story of Zhiko is a sad but common one among outskirt communities in Abuja, so close to the seat of power and influence, but so far removed from reaping the benefits of this proximity.
We have been contributing in government. Even this election, we give a very good number of voters. We are having 3 polling units here, in a small village. We cannot see what we are doing. We are helping the government, and the government is not ready to help us.
Some of the challenges we have, especially for this immunization section, that is RI, going out for outreach, it's always been a problem for us because of the mobility. Before we get to the outreach section, we have to take a bike that will cost us something. But if we have our own bike to fuel it, it will not be a problem.
In a few weeks, the school will open for the new session. What will then become of the makeshift clinic? And what will become of the healthcare of the people of the Zhiko community?